Hi, I'm Joe Graydon.
And I'm Terry Graydon. This podcast of the People's Pharmacy is brought to you by Squatty Potty Toilet Stools. They create healthy toilet posture for fast, easy elimination. Learn more about toilet posture and health at squattypotty.com. That's SQUATTYPOTTY.com.
Lots of kids have trouble paying attention. CDC figures show that nearly 1 in 10 has been diagnosed with ADHD. This is the People's Pharmacy with Terry and Joe Graydon.
The usual treatments for attention deficit hyperactivity disorder are stimulant drugs such as Adderall, Concerta, and Ritalin. More than 2 million children are taking such drugs long term, but the potential for side effects makes many parents nervous.
Are there alternatives? One expert says that by treating the whole child, many kids can be helped to manage their ADHD symptoms without drugs.
Coming up on the People's Pharmacy, integrative pediatrician Dr. Sanford Newmark tells us how to treat ADHD naturally with nutrition and behavior change.
First, this news.
In the People's Pharmacy Health Headlines, regular use of aspirin and nonsteroidal anti-inflammatory drugs can protect against colorectal cancer, but not everyone benefits from this effect. Researchers have known for many years that aspirin and NSAIDs like ibuprofen, naproxen, and diclofenac appear to have anti-cancer properties. But doctors have been reluctant to recommend such drugs because some people are susceptible to life-threatening bleeding ulcers. In this study, investigators looked at the genetic makeup of people who had developed colorectal cancer and compared their genomes to those of people without cancer. People with one of two specific genotypes, about 9% of the total, got no protection from taking an NSAID. A small proportion of people, about 4%, were at higher risk of colorectal cancer if they took one of these drugs. The risky genotypes are now known, and it should be possible for doctors to advise their patients whether it will be helpful or harmful to take aspirin or an NSAID for colorectal cancer prevention. The genetic tests are not yet available for clinical use, however, so it will be some time before this research will make a difference for ordinary people.
Many people drink diet soda with the intention of staying slim and healthy, or at least not getting any fatter. But a new study suggests that this strategy could backfire. In the bi-ethnic San Antonio longitudinal study of aging dubbed SALSA, 750 people 65 or above completed questionnaires about their diets every few years. During the follow-up period of about 9 years, people who drank diet soda every day added an extra 3 inches to their waistlines. By way of comparison, those who never drank Diet Pop added a little less than an inch during that time. While this is an association and doesn't prove causation, it is troubling. Extra fat around the middle is linked to a higher risk for diabetes, high blood pressure, and heart disease.
A large study from China found that people who took the B vitamin folic acid along with the blood pressure medication enalapril reduced their risk for a stroke. The researchers recruited more than 20,000 Chinese adults with elevated blood pressure. They were randomly assigned to take either enalapril or a single pill containing both enalapril and folic acid. Over the next 4.5 years, 2.7% of those on the combination treatment suffered an initial stroke, compared to 3.4% of those taking enalapril alone. People whose blood levels of folic acid were low at the beginning of the trial got the most benefit from the supplement.
When men lose interest in sex, it's sometimes chalked up to a lack of testosterone. New research from Sydney, Australia suggests, however, that a reduction in sexual activity can in and of itself lower testosterone levels. The researchers tested 1,700 men over 70 years old at the start of the study and after 2 years. They were asked standard questions about sexual activity and libido, and their hormone levels were measured. The baseline serum testosterone levels did not predict any changes in sexual behavior, but those who had low libido at the beginning of the study were more likely to demonstrate a drop in testosterone by the end of it.
Vitamin D levels may have an important impact on the risk of vascular complications from diabetes. People with this metabolic disorder are more likely to have heart attacks, strokes, and other cardiovascular disasters. They also develop kidney problems and retinal damage from microvascular damage. Researchers used data from a large diabetes trial conducted in Australia, New Zealand, and Finland to examine the effect of vitamin D levels in people with diabetes. There were more than 9,000 volunteers in the study, randomized to fenofibrate or placebo. Blood levels of 25-hydroxyvitamin D were measured at the beginning of the study. About half of the subjects had low levels of 25-hydroxyvitamin D. Over the 5 years of the study, these people were 23% more likely to have cardiovascular complications than those whose blood levels of vitamin D were higher. The study was not capable of determining if this association is causative, however, and no one knows if supplemental vitamin D will prevent problems. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. Attention difficulties seem to have become rampant among kids in this country. Are more youngsters being diagnosed with ADHD because teachers and doctors are looking for it? Or is there something else going on?
A lot of parents want to help their children be able to focus in school and play well with others, but they may be uncertain about whether medication is the best route. Is there a way to help kids overcome their attention problems without using drugs?
To learn more about a range of treatments for this common childhood problem, we turn to Dr. Sanford Newmark. He's Director of Clinical Programs at the Osher Center for Integrative Medicine at the UCSF Medical Center. He's also the Director of the Pediatric Integrative Neurodevelopmental Program at University of California, San Francisco. His book is ADHD Without Drugs, a guide to the natural care of children with ADHD.
Welcome to the People's Pharmacy, Dr. Newmark.
Thank you very much. Glad to be here.
Dr. Newmark, I'm so confused when it comes to these terms that we hear all of the time. ADHD, attention deficit hyperactivity disorder, or ADD, attention deficit disorder. What are they and how do they differ?
Okay, so they don't really differ at all. The terminology has just changed a lot over the years. Currently, the correct terminology for all this is ADHD, attention deficit hyperactivity disorder. And there is a subcategory called the inattentive type, and some people refer to that as ADD because there's no hyperactivity. That's the sort of spacey child who can't focus, but who's not at all hyper. And people used to refer to that as ADHD rather than ADD rather than ADHD, but we call it all ADHD now.
Well, you mentioned the word hyperactivity, and that's sort of what I remember from decades ago. And the implication was a child who couldn't sit still, daydreamer, just squirming.
A twiddler.
Yeah, all of the above. But we don't use that term anymore.
Well, it's in the word hyperactivity is in ADHD, attention deficit hyperactivity disorder, but we don't use it as a sort of standalone term. But it's still it's still really what a lot of these kids are like who truly have the disorder.
Dr. Newmark, I wonder if you can tell us how many youngsters actually have ADHD, and if that's more than in years past.
It is not only more, it is dramatically rising. Right now, there are probably over 9 million children who are diagnosed with ADHD, and over 4 million of them are taking medications. This is a very dramatic rise. If I weren't on the radio, I could show you a graph, but at 30 years ago, there might have been, or 40 years ago, there might have been a few 100,000 children with ADHD.
Good gracious. I mean, that's
Good
unbelievable.
gracious indeed. It is unbelievable, and it continues to rise.
Do we have any idea why?
Well, there's a lot of possible reasons why. I personally think misdiagnosis and overdiagnosis is one of the biggest reasons, but there are other reasons. I think, and I can get into them one by one, I think they're all interesting, but one of the big reasons I think is the stress that we put on children in our society, what we ask of them. ADHD is not like having high blood pressure or some other very clearly defined medical problem, in that everybody has some symptoms of ADHD. ADHD is some combination of hyperactivity, impulsivity, and difficulty focusing that causes impact in your life. It has to actually cause impact in two areas of life, which in children is home and school. So, I mean, everybody has some degree of being either a very quiet, stolid person or being a very highly active person. And everybody has some degree of being a little distractible or being very highly focused or being careful or being impulsive. And so there's a whole line of severity to people who have no symptoms of ADHD, to people who have, some of those characteristics. And when is it actually called ADHD? When it causes impact.
Now, Dr. Newmark, you mentioned the stress we put on our children. Can you give us an example, please?
I'll give you an extremely good example, which is kindergarten. 20 years ago, maybe 10 years ago, all you needed to do to go to kindergarten was to eat, sleep, and play, right? Now, kindergartners are expected to learn to read. This requires focus and concentration. Many kids are ready to do that in their level of maturity and the development of their brain, but a lot of them aren't quite there yet. And what happens now in our society is kindergartners who aren't able to learn to read easily suddenly are being diagnosed with ADHD. And so if they hadn't been asked to learn to read in kindergarten, they wouldn't have the diagnosis. And this relates to the overdiagnosis issue also, because there was a study that showed that if you were born in August rather than September, you were more than twice as likely to be diagnosed with ADHD and treated with medication.
Why is that?
Because you're the youngest person in the class.
Oh, so if you're born in September, you have to wait until the following year to enter school. Right.
Yeah. So this study, the author estimated it accounted for almost 1 million misdiagnoses. This study was repeated in Canada. It showed the same thing. In Iceland, the whole youngest third of the class was much more likely to be diagnosed with ADHD. So we're first of all putting all this extra pressure on these kids developmentally, and second of all, we're not even distinguishing just normal maturation from ADHD.
Well, Dr. Newmark, you mentioned kindergarten, and I think about, the kindergarten teacher who's going, well, little Mary, she's not focusing as well as the rest of the kids. She's not mastering her ABCs. She's not reading. Maybe she has ADHD. Let's send her to a psychologist. And she recommends that to the parents. And I'm wondering, because you've mentioned that overdiagnosis is a concern of yours, like who's actually diagnosing these kids with ADHD anyway?
Well, there's a lot of people are diagnosing them, but unfortunately, many, many times it's a pediatrician or family practice doctor who just doesn't have the time or the expertise to do it right. Other people who diagnose this are psychologists and child psychiatrists, but even some of them do a very, very non-thorough job and are very quick to make the diagnosis. I'll tell you a story a mom told me. She brought her 7 or 8-year-old in because the teacher had said something similar to a child psychiatrist who you'd think would be very good at this. And the child psychiatrist met them in the lobby and asked the child to wait and brought the mom in to talk to her, which is very appropriate. But he didn't actually talk to the child. And the mom began talking. And within 5 minutes, Mom said, he said, "Your child has ADHD." He brought out his prescription pad and started writing a prescription.
And he had never even spoken with the kid.
Exactly right. This particular mother got up and walked out, but many, many don't. And this is way too often the case, these very quick diagnoses that really don't explore the whole issue.
Tell us how ADHD should properly be diagnosed. What's the right workup?
The right workup is, for instance, in my practice, I see patients for an hour for one visit, and then they come back a second time for another hour. And this should include a very detailed history. In fact, it's history when you get to ADHD. A very detailed discussion with the parents, talking with the child alone, if they're old enough, which most of them are. Some kind of communication with the teachers. There's standardized forms which are helpful, which are given to the parents and to the teachers. But I find actually talking to the teachers is best. And sometimes there's they've had some kind of educational testing, which is important to review. All that needs to be taken together before making a diagnosis, really looking at the child, not just what's happening with his reading in kindergarten, but in the context of his family, community, friends, in a holistic fashion.
Well, you talk a little bit about this integrative approach, that is to say, looking at the child as a whole, not just as a medical diagnosis. What do you mean by that?
Well, it's similar to what I was just saying. What is this child doing in his life? Is he or she happy or sad or anxious or depressed? Does he have friends? Are they exercising, participating in sports? What are the family dynamics? How do mom and dad feel about what's going on? What's the behavior in the house, and how is that affecting things? What's going on in the school? What kind of a school is it? What kind of a teacher is it? I can't tell you the number of people who have come to me, and maybe a child is in fourth grade, and the story is, well, she did great in first grade, but second grade was terrible. But then third grade was really good too. But now fourth grade, oh, things are awful. She can't pay attention. Well, a lot of that is the teacher, that fit between the teacher and the student, or between the school and the student. So that's how you need to take care of or look into every aspect of what's going on with a child before making a decision. Another example is children who have been exposed to violence, who have been abused, who experience post-traumatic stress disorder. Those children can look like they have ADHD, but that's not really the issue.
You're listening to Dr. Sanford Newmark, Director of Clinical Programs at the Osher Center for Integrative Medicine at the University of California, San Francisco. He's also the director of the Pediatric Integrative Neurodevelopmental Program at UCSF. His book is ADHD Without Drugs, A Guide to the Natural Care of Children with ADHD.
Terry, there's some new research suggesting that stress, especially family violence, can affect genetic factors and gene expression in children.
Well, especially gene expression. The research was done in New Orleans and found that kids exposed to family violence have shorter telomeres. Those are the little caps on the ends of the chromosomes.
We need to take a short break. When we come back, we'll find out if ADHD is being overdiagnosed or confused with other conditions.
Parents and teachers often think of ADHD as a liability, but does it have to be?
We'll learn about the standard treatment of ADHD and the side effects of the drugs that are used to treat it. We'll also talk about breakfast, which choices are healthy for children and help them focus, and which may undermine their ability to pay attention.
You're listening to The People's Pharmacy with Joe and Terry.
If you like this podcast of The People's Pharmacy and want to continue the conversation, you can join us online at facebook.com/People's Pharmacy to share your thoughts or comments. Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is made possible in part by Squatty Potty toilet step stools, creating healthy toilet posture for fast, easy elimination. More information about how toilet posture affects your health at squattypotty.com.
And by Red X Industries, makers of utterly smooth creams and lotions that deeply moisturize to make dry skin feel soft and smooth. 800-345-7339, online at uttercream.com.
If you would like to order a CD of this show or any other People's Pharmacy broadcast, you can call 800-732-2334. This is show number 986. That number again, 800-732-2334, or find it at our website, peoplespharmacy.com.
Today on the People's Pharmacy, we're talking about ADHD and how to help kids who have trouble sitting still or focusing. Our guest is Dr. Sanford Newmark. He's Director of Clinical Programs at the Osher Center for Integrative Medicine at the UCSF Medical Center. He's also the Director of the Pediatric Integrative Neurodevelopmental Program at University of California, San Francisco, and author of ADHD Without Drugs, a guide to the natural care of children with ADHD.
Dr. Newmark, you mentioned that ADHD can be overdiagnosed, and you have written in your book that there are other things that get confused for ADHD. Can you tell us about some of the confounding? What else should parents and teachers and doctors be considering as possible causes behind the child's behavior?
A very good question. So one of the biggest one is some type of learning disability, like dyslexia. So say Johnny's in kindergarten and has dyslexia and really is not picking up how to read. Well, what can happen is he can get frustrated, he can get distracted very easily, start acting out, and it looks like he might have ADHD, but he could very easily have learning disabilities. And this is something that has to be tested by a psychologist, an educational psychologist, to find out if that's happening. It's a little difficult as early as kindergarten, but it can be done. But as they go up in the grades, this is something that really needs to be looked at because the treatment is completely different. Making it more confusing, you can easily have both ADHD and learning disabilities. So as you can imagine, it takes some time to sort out. Another thing that can be a problem is anxiety. Many children with ADHD have anxiety. It's the most common what we call comorbid condition, the thing that goes along with ADHD. But I actually think it's just misdiagnosed. So many kids who just have anxiety are labeled as having ADHD. Depression, as we talked about, PTSD. An interesting one is sleep apnea. If children aren't sleeping well, if they're not getting enough oxygen at night, this can look like ADHD. And another really one thing I think is very common is just the difficult child, the temperamentally difficult child, the child who does what he or she wants when they want to do it. And they may be able to concentrate and focus when they feel like, or behave well when they feel like, and if they don't, they won't. Not always ADHD.
Oh, we've met a couple of kids like that in our lives.
Right. I had one in my family, so I know what I speak of.
Now, Dr. Newmark, we've been talking about ADHD as if it were a liability, a problem. And we've talked to Dr. Ned Hallowell, a child psychiatrist up in the New England area, who has looked upon ADHD as a gift. And he's often described it as children who have a Ferrari motor with bicycle brakes. And
right, that's a great description.
Great description. And we've met a lot of people with ADHD, or what we'd call some of the symptoms of it. I remember a dear friend, Dr. Dean Adele from the Bay Area.
Oh, I used to listen to his show.
Right. And Dean said, I have ADHD, but I've done well with it. It's been a gift for me. I can do a lot of things. I can focus on a lot of different projects. So how do we convert this notion of ADHD as a liability and a problem that absolutely has to be treated or medicated to a possible gift?
Well, I think it's education. I think there's I totally agree that people with ADHD often have a great variety of skills and strengths that come in very useful. They're often very, very good at being entrepreneurs or salesmen or starting their own businesses and things like that. They have this great energy often and the ability to do a number of things at once and drive. So that can be really, really helpful. The problem is that at the extremes of ADHD, it is really a liability. These people get fired from jobs. They can't focus enough to get anything done. They lose their relationships. They have no friends. But to me, that's a really small percentage of the population of ADHD out there. And many of the others, we need to really focus on their strengths. And that's something I try and talk to parents about. I ask this question all the time. What are they good at? What are their strengths? What do they like to do? And often you get they're great with people. They're empathetic. They're tremendous at art or painting or sports. So, yeah, I agree.
Dr. Newmark, when a child is diagnosed with ADHD, or an adult for that matter, usually, as you mentioned, the prescription pad comes out. Tell us a little bit about the standard treatment for this condition.
So the standard treatment for ADHD, which 98% of doctors probably do, is psychostimulants. Things like Ritalin, Adderall, and all these other stimulants. And the problem is, let me back up. I mean, behavioral treatment is also supposed to be recommended if you look at the American Academy of Pediatrics recommendations, but very often this falls by the wayside very quickly, and you're just left with medication. And the problem is we do know that short term, for about 70% of kids, medication works very well. It can help, and I use medication myself on a number of patients, although I try to avoid it, especially at first. But it does have a lot of side effects, and the data showing that it really helps in the long term is very weak or non-existent. So yes, you can demonstrate in study after study after study that, if you give it for a month or 2 months or 3 months, these kids have better function by standardized tests. But if you look at these kids a few years later, the few good studies that have done that are really not finding the kind of improvement you'd expect long term.
Now, Dr. Newmark, you mentioned that these drugs do have side effects, and that's something that parents really worry about. So tell us a little bit more about the side effects of these stimulant medications.
Okay, so there's some very well-known physical side effects. They almost always cause a decrease in appetite. Most of the time, it's not a big problem. Sometimes kids actually lose weight and you have to do something else. They can cause some mild stomach discomfort, which usually goes away. They can cause tics, which, little involuntary movements, which mostly go away when you stop the medicine, but don't always. They can cause depression. They can cause anxiety. They can cause irritability, difficulty sleeping, headaches. I don't want to overemphasize this because, if I told you all the side effects that are possible from Tylenol, you'd probably never take it again, as you well know. But it can be a problem in a number of kids. But more worrisome, I think there's a lot of subtle side effects that don't get reported in the literature. Things like children just aren't themselves anymore. Yes, they're doing better in school. Yes, their behavior's better. But people say to me things like, well, he's just not himself, or she's just lost her joy. Let me tell you a quote. I had a mom whose daughter was on Adderall for a couple of years, and she was doing really well in school, and she thought things were going great. And the teacher said to the mom, "Could your daughter be depressed? She seems kind of flat." And mom was taken aback, but she began looking at her daughter and thought, well, maybe she is. And so she stopped the Adderall, and mom's exact words to me were, it was as if the Adderall was a dam holding back her happiness.
Wow.
That as soon as she stopped the Adderall, suddenly this sort of happiness and joy and spontaneity emerged. And what's scary about that is, number one, that it can cause that problem, and number two, that it was subtle enough that mom didn't really pick it up. And I've seen that happen before.
Yeah, I was going to say, I wonder how many times that occurs. So, Dr. Newmark...
Oh, by the way, and kids will express this to you, but not directly, because they don't quite understand it. But sometimes they'll either say, I don't like this medicine, and you say, why? Well, I don't like how it tastes, or something like that. But often they say, well, I'm bored. And what they really mean is life isn't as much fun anymore.
Wow, that's fascinating because we've not heard that before from anyone. So that's really interesting and something that parents should be aware of.
Very definitely.
Dr. Newmark, the title of your book is ADHD Without Drugs, subtitled A Guide to the Natural Care of Children with ADHD. So maybe you can give us a little sense of what your integrative approach means, and in particular, the importance of good nutrition.
Absolutely. So nutrition is the first place I look. And there's two things about nutrition that are important. One is just basic good nutrition, and the second thing is food sensitivities and elimination diets. Let me start with basic nutrition. What I say in my lectures is, when did Pop-Tarts become breakfast? When a child eats a Pop-Tart or something like that for breakfast, it's basically white flour and sugar with some additives thrown in. And what happens is this sugar goes directly into the bloodstream, causes a dramatic increase in blood sugar, which the body doesn't like, and then the blood sugar hormones are produced and the blood sugar goes plummeting down, and pretty soon they're relatively hypoglycemic, which can make them irritable and have difficulty paying attention, and this can look like ADHD. The other thing is, a breakfast like that, they don't have any nutrients. They don't have the vitamins, they don't have the protein, they don't have the good fats that they need. Unfortunately, it's not just Pop-Tarts. Think about a very common breakfast, waffles with syrup, even if they're whole grain waffles.
Dr. Newmark, you have just stumbled onto one of our favorite soapbox topics. Keep going.
All right.
Well, in part because people thought that was a really healthy breakfast because no cholesterol.
Right. And this is part of, I'm sure you know, this great, wipe out the fat and everything will be okay sort of thing we had going in our society. And we know better now. We know that these high glycemic, highly processed carbohydrates are very bad for you. So, basically what I say is, if you're going to give waffles and syrup or Pop-Tarts for breakfast, you might as well make it easier on yourself and get a big funnel and pour about 15 tablespoons of sugar into it and put it into your child's mouth, because it has the same effect. So I recommend a good breakfast with protein, with some good fats, with fiber, and with non-processed carbohydrates. And
All
it's
right.
not that hard.
Give us an example.
Oatmeal. Yeah,
Okay,
oatmeal. Is a piece of good whole grain bread with peanut butter and a glass of milk. Healthy breakfast meats are even okay, not with preservatives and stuff. And also I tell people, breakfast doesn't have to be breakfast foods. That's a cultural phenomenon, not a nutritional one. If you have a good bean and cheese burrito left over from the last night, that's a great breakfast.
And of course, if you get your kids started eating that kind of breakfast early, they'll think it's normal.
Yeah, absolutely. Here in San Francisco, we have some people here who are at the very cutting edge of the diet world, and you wouldn't believe what these kids eat. Seaweed and sushi and all these wonderful, healthy things. And it's because they started them early. It's really quite remarkable. Anyway, so I think overall basic nutrition is very, very important. And then another thing is, it turns out that many of these children are very sensitive to certain foods. They're not particularly allergic, but certain foods make them hyper, make them have difficulty paying attention, cause symptoms of ADHD. And for many of these children, I put them on an elimination diet where we eliminate for just a few weeks dairy, wheat, corn, soy, and eggs and nuts. And a really good percentage of them, maybe 30 to 50%, have a very positive reaction. Their ADHD symptoms drop away.
Well, Dr. Newmark, this sounds a little bit like something from the history of medicine. Dr. Feingold and his elimination diet, but what he was eliminating was artificial colors and flavorings.
That's exactly right. Dr. Feingold didn't get into eliminating actual foods, but artificial colors and flavors are one of the biggest things children are sensitive to. There's been a lot of research about that. The research is so conclusive that in Europe, if you put certain artificial colors in your product, you have to put a warning label on it. This may make your child pay less attention and be hyperactive.
Dr. Newmark, I remember when physicians and Public health organizations were just incredibly critical of Dr. Feingold. Like, what's he talking about? There's no science here. He's a quack. It sounds like he's been vindicated.
I think to a certain extent he has. I really think he was onto something with that. Now, he had some other stuff with salicylates that he tried to eliminate, which we're still not so sure about, but that's another thing. But, in terms of science, there's been a number of studies, the latest of which appears in The Lancet just a couple of years ago. The Lancet is, being one of the most highly respected medical journals in the world. Since the 1980s, they have been doing studies showing that this kind of elimination diet can improve symptoms of kids with ADHD. There's been at least 4 separate good studies that show this. And yet, 98% of doctors have no idea that this is true, and they would tell patients that, forget that elimination diet stuff.
Why is it not better known?
Well, I think there's a couple of things, and I'm probably going out on a little bit of a limb here. First of all, most doctors get a great deal of their information from pharmaceutical companies. And pharmaceutical companies are not eager to distribute this information. Believe me, when this study came out, the farm reps were not in the doctor's office waving it around saying, look, you can treat ADHD with an elimination diet. And many of the doctors who make the evidence-based guidelines and who do the studies about ADHD have a number of financial ties with the drug companies. That's just a fact. And I don't think they have poor intentions, but I think it would be very naive for us to think that physicians and other scientists who have financial ties with pharmaceutical companies can be objective in their research and interpretation of their research.
Dr. Newmark, could you give us a quick overview of what is an elimination diet?
So, yes, it's very simple. Not always easy, but simple. I ask parents for 3 weeks to eliminate dairy, wheat, corn, soy, eggs, and nuts, and during those 3 weeks to watch their child very carefully for their ADHD symptoms. And after 3 weeks, if the child is improved, you start adding the foods back one by one and look for changes. If you see that adding wheat, say, causes a return of those symptoms that are improved, then you know that wheat is the culprit. And so you keep wheat out of the diet, or at least mostly out of the diet. That's what it is in a nutshell.
You're listening to Dr. Sanford Newmark, Director of Clinical Programs at the Osher Center for Integrative Medicine at the University of California, San Francisco Medical Center. He's also the Director of the Pediatric Integrative Neurodevelopmental Program at UCSF. His book is ADHD Without Drugs, a guide to the natural care of children with ADHD.
And Terry, this isn't the first time we've heard about the elimination diet.
No, we've heard about it before for kids with leaky gut syndrome and juvenile arthritis.
We need to take a short break. When we come back, we'll learn about how well an elimination diet can actually work.
We've heard before that parents should manage their kids' behavior, but how? We'll get some practical advice.
We'll also find out about dietary supplements such as omega-3 fats and minerals. Can Chinese medicine make a difference?
You're listening to The People's Pharmacy with... If you're enjoying this People's Pharmacy podcast, why not head over to our website where you'll find a wealth of information on medications, conditions, home remedies, and ways to keep yourself healthy. You'll find it all at peoplespharmacy.com.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Squatty Potty Toilet Step Stools, creating healthy toilet posture for fast, easy elimination. More information about how toilet posture affects your health at squattypotty.com.
And by Redex Industries, makers of utterly smooth foot cream with shea butter, helping dry, cracked feet feel soft and smooth. The number's 800-345-7339, online at uttercream.com.
If you'd like to order a CD of today's show or any other People's Pharmacy episode, you can call 800-732-3738. 2334. Today's show is number 986. The number to call is 800-732-2334, or you can place the order online at peoplespharmacy.com.
Today we're learning how children with ADHD can be helped with treatments other than medications. We're talking with Dr. Sanford Newmark, Director of Clinical Programs at the Osher Center for Integrative Medicine at the University of California, San Francisco Medical Center. He's also the Director of the Pediatric Integrative Neurodevelopmental Program at UCSF. His book is ADHD Without Drugs, a guide to the natural care of children with ADHD.
Dr. Newmark, you've mentioned that you frequently recommend to parents that they try an elimination diet for a child who's having difficulties focusing in school or trouble at home. How often is the elimination diet successful?
I'd say in my practice, I see significant results in about 30 to 50% of children. And I think that's a pretty big number, considering that it's something that has no side effects and you can use long term. I just wanted to give you an example. I had this child who was about 9 years old, and he was an Asian child, and mom was a totally self-professed tiger mom. And she tried the elimination diet, and he was a child who had dramatic results. His grades went from 50s to 90s. But what she said to me was so interesting. She said two things. First of all, she said, well, I just did this so I could check it off my list before we started medication. I never thought it would work. And then she said, if I had heard from somewhere you claimed the elimination diet could work this well, I would have called you a liar on every blog or listserv I could find.
And yet it was something that worked for her kid amazingly well.
Yes.
Oh, that's great.
She's become quite a convert now.
I think another recommendation that is often made when we're talking about natural approaches to treating ADHD, and I know you make it in your book as well, is that parents need to help manage their kids' behavior. So can you tell us a little bit about what that means, the behavioral approach to treating ADHD?
I'd very much like to do so. Many kids with ADHD are pretty oppositional, and sometimes they're diagnosed as having ODD, oppositional defiant disorder as well. Many of these children are really difficult. They're not cooperative. They can be defiant. They don't pay attention. They don't do what you want. It's very difficult to get them out to school or to other activities. And what happens is parents get very frustrated and angry and upset. And the same parenting methods that may have worked well on their other children or they see are working well with their friends' children just don't work for them. And they get into this kind of way of parenting which is halfway being angry and yelling at the child and the other half letting them get away with murder. So the child doesn't know what's going on, and the parents are frustrated, and they really need some help. And the kind of help that they need is to have some system of working with these children. And there's many systems which can work, but there's one I think that is wonderful called the nurtured heart approach. And in this approach, it combines a great deal of added positivity to the child because these kids get lots of negatives all day long. Why didn't you do this? How come you forgot your homework? Sit still, blah, 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 blah. Pretty soon they start seeking out negative attention because it's the only kind of attention they can get. So you reverse this by giving them really added positive attention for the things they do right, and also a very consistent discipline for when they don't do things right. But that discipline is given without yelling or anger or lecturing, so they don't get any energy from the parents for things they did wrong. They just get a consequence. And then there's a very good credit system attached to that. That's a very brief description, but I found it to be tremendously successful in a number of kids. In fact, I've given this to hundreds of families, and 90% of the families who really put it into play say that it has been significantly helpful for their children. And that's along with whatever else we do with ADHD.
It sounds very sensible, but it's also a little abstract. Can you give us a little bit of an example?
Yeah, so let's say that your child, Johnny, is playing with his sister, and you're quietly, and what happens when kids play with their sister quietly? Well, parents go do something else. So they go start to wash the dishes, and they hope things go okay. Suddenly, Johnny hits his sister on the head. They both come running in. Sister's crying, and Mom now starts yelling at Johnny about what he did wrong and sends him to his room, and everybody's upset. So what has Johnny learned? Johnny has learned that if I play quietly with my sister, Mom ignores me. But if I hit her on the head, I'm going to get a lot of attention. Now, that's not conscious, but that is truly what he learns. Now let's have another scenario. Johnny is playing quietly with his sister. Every few minutes, Mom might walk in and say, "Wow, I see you guys are doing this. That's pretty cool." Or, "Wow, it's great to see you guys playing so well together." Now he's still playing with his sister. It just takes a few seconds, but he's still getting that positive attention from Mom. If he does do something wrong, hits his sister anyway, Mom would very quietly say, "I'm sorry. You know there's a consequence to that. Please go off to your room for 5 minutes." That's an example of how it might work.
Well, it sounds like a really helpful approach at home. But what about in school? I mean, a teacher nowadays has maybe 25, 30 or more students in her class, or his class for that matter. And, there's one or two kids that are just sort of always acting up or causing disruption, and the teacher doesn't have a lot of time to devote to those kids. So they're a problem, and they're disruptive, and, he or she is going to have to, squelch that because the rest of the kids may start to act up as a result. So how do you employ not behavioral parenting, and as you might call it at home, but behavioral teaching so that teachers can actually figure out how best to deal with children with ADHD?
Well, it's a really good question. One thing I will tell you is there's a school in Tucson where I used to be from where the principal insisted the nurtured heart approach should be put into the entire school, from the principal right on down to every teacher and worker. And in this school, the rate of ADHD diagnosis and stimulant use and discipline problems went down dramatically, and their test scores went up dramatically. So this can happen in school. But also, many teachers know how to do this instinctively. Many teachers can work with these kids very well, tying into what I said before about the fit between the teacher and the child. Now, there are some kids at the extreme end of ADHD who are so difficult that something else has to be done. I recognize that. But for many of these children, just a few positive words during the day and just very calm consequences when they do something wrong can really turn things around.
Dr. Newmark, we were fascinated by the idea that some dietary supplements may be helpful. Can you tell us a little bit about omega-3 fatty acids and why you're an enthusiast?
Yes. Well, omega-3 fatty acids are very important for brain function in a wide variety of areas. And they are one of the best studied supplements for ADHD. So children with ADHD have less omega-3 fatty acids when you measure their blood level than kids without ADHD. And we don't really know why. Even if you do an experiment where they eat the same amount of omega-3s and omega-6s for a while, they still have lower levels in their blood. So something about how they metabolize them or digest them is off. And there's been a number of studies of giving children with ADHD omega-3s to see if they've improved. And most of them do show improvement. In fact, just in the last couple of years, there is a big meta-analysis which looked at all the studies and found that omega-3s were indeed what they called modestly effective in improving the symptoms of ADHD. And modestly effective was about 40% as effective as medication. But I think that's pretty remarkable for a substance that has almost no negative side effects and is essentially a nutritional supplement. So given that evidence, I recommend fish oil, which has omega-3s for every child with ADHD.
So this is a little reminiscent of the elimination diet. If it was a drug, the pharmaceutical industry would be promoting it, and you probably see commercials on television. The omega-3 fatty acids, the drug companies aren't saying a word. Of course, the FDA is probably not giving them permission to do that, even if they wanted to. So in your book on page 99, you have a brief rant about why we haven't adopted the omega-3 approach.
Yeah, I think, the big problem is that if things are not being pushed by pharmaceutical companies, then they don't get to the doctors on the front line who are doing things. And even very good, well-researched remedies do not get put into common use. And I think that has to do with the very basics of how doctors are trained. We get very, very little nutritional training in medical school and not much after that. And where they get their information from, as we've spoken about, and who controls the flow of information. It's really frustrating to know that many of these things can be very effective. And even when there's research, doctors don't know about it.
Are there other nutrients that may benefit kids if they're taken as supplements?
Yes. One of the really interesting ones is iron levels. It's been shown that children with ADHD have lower levels of circulating iron in their bloodstream and in their brain, and that when you increase these levels, you can actually improve ADHD symptoms. So I actually measure something called ferritin, serum ferritin, in every kid with ADHD, and treat with iron when it's low. Now, that's not something you want to give to everybody, and not something that every parent should go out and buy some iron, because too much iron is bad as well. But it should be checked, and it's a very simple blood test. The same is true of zinc, although the research isn't as conclusive with zinc. So iron and zinc are two things that I think are really important to take a look at.
What about other minerals like magnesium?
Magnesium has had a little bit of research. It intuitively seems like it would help because magnesium is kind of a relaxing mineral in general. Epsom salt baths are magnesium. The research isn't really as good with magnesium, but I think it's always fine to add. And if you give reasonable amounts, you won't give too much.
Other alternative approaches, such as traditional Chinese medicine, energy medicine, anything else that you found helpful?
I sometimes use things like traditional Chinese medicine, energy medicine, Ayurveda even once in a while. But the really interesting approach that's sort of alternative, but not really, is called EEG neurofeedback. It turns out that kids with ADHD have different brainwave patterns than kids without ADHD. They have too many theta waves, which are your spacing out waves, and not enough beta waves, which are your concentrating waves. And in fact, the FDA just licensed a test that measures beta to theta ratio as a possible part of the workup of ADHD.
Now,
But
can
more
that be
interesting-
changed in any way?
That's what I was about to say. Kids can actually, using a biofeedback technique, which we call neurofeedback, change their brainwave patterns. And there's been really a good amount of research on it, and most objective observers agree that it is probably to definitely effective for ADHD.
That's pretty exciting.
It is. You might think, why aren't we doing anything about this? And why isn't everybody doing this? It seems so easy. Well, the problem is it's very time-consuming and expensive. This is something that has to be done in a psychologist's office. Usually it's 30 to 40 sessions. And insurance won't pay for it. Well, that's the big killer.
It sounds like something that in the not-too-distant future we might have home devices. We now have so many devices like electrocardiograms that'll hook up to your smartphone. So maybe someday there'll be a kind of feedback system that'll allow kids to do this at home without the huge expense.
Right. I can see that happening, but I think we have to be a little careful about home devices, because you don't just want to buy a $39 device that's going to measure your brain waves and have people who don't know what they're doing mess with it. Because,
right.
you don't want kids to do the wrong things with their brain waves either.
Dr. Newmark, we've been talking a lot about the treatments for ADHD, especially with regard to your integrative approach. But I'd like to ask a kind of fundamental question, if I may, and that is, why is there so much ADHD these days? I mean, yes, you've mentioned overdiagnosis, but what about the environment?
Well, that's very interesting. It turns out that there's a number of environmental factors that can cause an increase in ADHD, and this relates to toxins in our environment. There was one study where they looked at the umbilical cord blood in a set of babies, and this is the blood that's been feeding their brain for the 9 months of pregnancy before they take a breath, and there were over 200 industrial chemicals in that blood. And most of them were known to be neurotoxins, toxic to the brain. So this is the bath our babies are growing up in. And there actually have been studies that show that when kids have abnormal or higher amounts of pesticides, for instance, in their blood, their development is less advanced than babies who don't, and they can have more ADHD. There was one very interesting study that showed that kids who had higher than the average level of pesticides in their bloodstream, as measured in their urine, had twice the risk of having ADHD. So I think environmental factors are a reason there's actually more kids who have the symptoms of ADHD.
Dr. Newmark, we are almost out of time. Can you give us a bit of a summary, please, on the best ways that parents can support their kids with ADHD?
I think first we need to be very careful not to overdiagnose ADHD and to take the time to do a careful diagnostic workup. When a child does have ADHD, I think it's important to do a comprehensive evaluation and to at least try the non-pharmaceutical methods, which can be very helpful before going straight to medication.
Dr. Sanford Newmark, thank you so much for talking with us on the People's Pharmacy today.
Well, thank you. It was my pleasure.
You've been listening to Dr. Sanford Newmark, Director of Clinical Programs at the Osher Center for Integrative Medicine at the University of California, San Francisco Medical Center. He's also the Director of the Pediatric Integrative Neurodevelopmental Program at UCSF. His book is ADHD Without Drugs, A Guide to the Natural Care of Children with ADHD.
Lynn Siegel produced today's show. Al Wadarsky engineers the program. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
To order a CD of today's show or any other People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 986. That number, 800-732-2334. On the web at peoplespharmacy.com.
When you visit our site, you can check out prescription drugs, herbal medicines, and home remedies. Share your own experience and your thoughts on today's show, and look for our combination offer of today's show on CD plus Dr. Newmark's book on ADHD, so you can listen and read.
When you go to our website, you can sign up for our free online newsletter. It comes to you twice a week, or the free podcast of the show. You'll never miss another People's Pharmacy program again. You can also share it with a friend. It's all there at peoplespharmacy.com. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening, and please join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to the People's Pharmacy.
When it comes to Father's Day, some things never change. Dads want steak. And the experts at Omaha Steaks are making it easy for you to deliver uncompromising quality with gifts that are sure to make his day. Plus, get an extra $35 off with code THANKSDAD when you shop omahasteaks.com today. We know being your dad means he already has everything he could want. But just picture the look on his face when he sees those extra-aged USDA-certified tender steaks, juicy air-chilled chicken, beefy burgers, and more. With carefully curated gift packages from America's original butcher, it's never been easier to show everyone why you're dad's favorite. And every bite is 100% guaranteed to bring a thrill to the king of the grill. Shop now at omahasteaks.com and get an extra $35 off with code THANKSDAD. But don't wait. Father's Day is June 15th. Minimum purchase may apply. See site for details.